Hey everyone, welcome back to my channel. So this is probably one of the highly requested videos ever, and I totally understand how complicated pressure volume loops might be, but in this video, which is a little comprehensive, I'm gonna try to simplify as much as I can. I'm going to give you kind of a scheme to think about it. We're going to do questions together, and finally I'm also going to explain this dreadful page of first aid. So stay tuned, guys. Let's get started. Alright guys, so before I dive into the actual loop, something will help you immensely if you think about the factors affecting stroke volume. So if you take the pressure volume loop in the context of the cardiac cycle and the three factors affecting stroke volume, everything is going to be easy. So preload is coming in from venous return. The more the preload, the more the stroke volume, and afterload is the resistance that the heart has to face in order to beat. The greater the afterload, the less the stroke volume. So this figure actually is a very nice analogy, as if someone is riding a bike. So the preload is the push by air. The afterload is the resistance of the road. And contractility is how fast he's able to, cycle, right? So once you understand, once you think about the pressure volume loop in terms of these three factors, it should be easy, especially when we apply it on the valvular diseases as we should. So in order to understand what pressure volume loop is, I would like to tell you guys that this represents a relationship between volume in the left ventricle, the volume of blood in the left ventricle during the cardiac cycle, and the pressure changes that take place in the left ventricle during the cardiac cycle as well. A lot of you guys do not understand some basics of what a graph is. So on the x-axis, when I go this way, that means the volume is increasing. I go this way, that means the volume is decreasing. So when you see a straight horizontal line going like this, that means I'm filling the heart. When you see a straight horizontal line going the other way, that means I'm emptying the heart. The same goes for pressure. When you see pressure going up like this, that means it's increasing. A line going down like this, that means pressure is decreasing. Now, when you see a straight vertical line or a straight horizontal line, that means it's a change in one factor only. If it's a straight horizontal line, it's only a change in volume. If it's a straight vertical line, it's only a change in pressure with no change in volume. But when you see both, something going up like this, that means it's going up in pressure as well as if it's going this way, for example, that means the volume is decreasing because I'm going to the negative side, and because I'm going up vertically like this, that means the pressure is increasing. So with this background, I would like to show you guys the actual pressure volume loop, and let's take a look at how it relates to the cardiac cycle. So I would like to start from diastole. At the start of diastole, when the mitral valve opens to allow blood to fill the heart. Because blood is filling the left ventricle, and this loop is about the left ventricle, that means that we are going this way. The more I'm going this way means the volume in the left ventricle is increasing because I'm filling the heart, right? So it will keep filling until the left ventricle is fully filled with blood and the mitral valve closes. The mitral valve will close when the pressure after it is high. The pressure after it is high, obviously, because blood is filling the left ventricle. Now, at the end of diastole, which is at this point when the left ventricle is fully filled with a lot of volume, which is right here, 150, This is called end diastolic volume, the volume of blood in the left ventricle at the end of diastole. And this determines the preload. If you remember, I talked to you about the factors affecting stroke volume. In order to push enough blood out of the heart, we need enough filling blood to begin with to stretch the heart, which is the preload. Now, after the mitral valve closes, we should prepare for systole, because this is the end of diastole right there. End diastolic volume, remember, it's the preload. To prepare for systole, we need to increase the pressure of the left ventricle so much that it overcomes the pressure of the aorta. So going up from about 10 millimeters of mercury, we need to go all the way to past 80. Now, with both valves closed, the mitral valve is closed and the aortic valve is still closed right now. It didn't open yet. In order to open it, we have to increase the pressure by contracting, but at the same time, both valves are closed. When both valves are closed, blood cannot go anywhere, so there is no change in volume. Hence, it's isovolumetric. And because we are contracting to increase the pressure, it's called isovolumetric contraction. This should open the aortic valve, as it has overcome the pressure of the aortic valve. The pressure that we reached at this point in the left ventricle is called left ventricular systolic pressure. This, guys, is the afterload. This is how much the left ventricle had to overcome in order to open the aortic valve. Keep this in mind. Preload is end diastolic volume. It's this point on the curve. Afterload is left ventricular systolic pressure. It's this point on the curve. So preload is a volume. Afterload is a pressure. Keep this in mind, guys, as we do the questions. Now, as the blood comes out of the heart, now we're going to continue systole. We have increased the pressure. We've overcome the aortic valve. We're going to push the blood out of the heart. So we're going to empty the blood that we have filled. The left ventricle is being emptied, and so the volume is decreasing because volume is being pushed out, right? So I'm moving to the negative side. I told you guys that this way it's decreasing in volume. It's emptying, right? But at the same time, you see some sort of a vertical upwards like this, because during this phase, we also have an increase in pressure until it reaches the maximum systolic pressure of 120. Once it starts, the pressure starts going down a little, the aortic valve will close, and we're gonna start diastole. But in order to start diastole, in order for the left ventricle to accommodate blood and start filling, its pressure needs to go all the way below that of the left atrium. And so I'm gonna do isovolumetric relaxation in order for the mitral valve to open. Now, a very important parameter here you have to consider, guys, is stroke volume. This is the volume of blood pushed out per beat. You can see here that I told you as I move this way, I'm emptying the blood that I filled during diastole, and I'm now emptying it in systole. The width of this curve is the stroke volume. So we can say that starting A, B, C is systole, ventricular systole. This is its isovolumetric phase, and this is its rapid ejection phase. And we can also say that from here all the way up till here is diastole. Now let's do a couple questions. A 54-year-old man is admitted to the hospital due to cough, shortness of breath, chest discomfort. He has a known history of coronary artery disease, underwent coronary artery bypass graft surgery 3 years ago. As a result of drug therapy, the left ventricular pressure volume loop changes from a solid to a dashed line. So what happened, guys? Did the preload change, which is the end diastolic volume right there? No, it's the same. Did the after load change, which is the left ventricular systolic pressure that I told you about right there. This is the after load. No, it's the same. What happened is that this curve has become wider, and I told you before that the width of this curve represents stroke volume. So you see here how the background we just talked about kind of helped us. Now there's a point I forgot to mention, guys, which is this point or this point. It's called the end systolic volume, because after systole is over, when the aortic valve closes right there and we start preparing for diastole and I go down isovolumetric relaxation, until the mitral valve opens, the blood remaining in the left ventricle after systole is called the end systolic volume. You should expect that when I have more blood pumped out of the heart, when I have more stroke volume, less blood will remain behind. So the more the stroke volume, the less blood that remains behind. So end systolic volume should be less when you have more stroke volume. All right, moving on to the next question. A 44-year-old man is hospitalized with multiple injuries following a motor vehicle accident. An arteriovenous shunt created by the injury would most likely result in which of the following changes in the left ventricular pressure volume loop. The solid line is pre-injury and the dashed line is post-injury. So what exactly, guys, is an arteriovenous shunt? And I want you to think about it in terms of preload and afterload. It will make things much easier, like I told you in the intro. So normally blood flows from the arteriole through the capillaries to the veins. Now the capillaries act as a major bed of resistance. Now when blood goes through the capillaries, it slows down, so it flows at a much slower rate, and at the same time its pressure goes down, and it faces so much resistance here until it reaches the veins, and it starts, and by the time it reaches the veins, the pressure would be so much lower. Now, when you bypass all that through an arteriovenous shunt, what happens is that blood is pushed at the same pressure that it was in the arterioles all the way to the veins. So you have higher pressure in the veins and you have less resistance to flow. Instead of taking this complicated route, I took a direct route. So what that means is that you're going to have less afterload because of less resistance. And we're going to see what that means on the pressure volume loop. And at the same time, because I have more pressure and faster blood in the veins, I should have more preload. So if you take a look here, which curve shows you less afterload, which means that the pressure is down, the left ventricular systolic pressure goes down, and more preload, which means that this point end diastolic volume goes towards the positive side. So more preload, less afterload. This curve shows more stroke volume, it's just a change in width. This curve shows more afterload, and this curve shows less preload. This end diastolic volume is pushed this way. Now I'm gonna do another question and then move on to this page of first aid. A 45-year-old man presents the ER with a 2-day history of dyspnea, orthopnea, and ankle swelling. This morning he developed nausea, vomiting, and a headache. Physical exam of his pulmonary crackles, bilateral pudding edema. A nitroprusside infusion is promptly initiated. Which of the following pairs left ventricular pressure volume relationships best represents the effect? The solid line is before and the dashed line is after nitroprusside. Now, what exactly is nitroprusside? It is a vasodilator. It dilates the arteries and dilates the veins. Remember, guys, when we dilate the arteries, that means I'm decreasing this clamping effect. That means I'm decreasing the afterload. And so this high high peak of the curve should go down a little. So the afterload is going down. And when you dilate the veins, more blood is going to pool down behind. More blood is going to pool in the periphery. And it's not going to go back to the heart. So when we dilate the veins, the preload decreases. So this drug decreases preload and afterload, which is why it's useful for heart failure. It decreases the load on the heart. So which of these curves shows decreased afterload and decreased preload? It's this curve, guys. Decreased afterload means that the pressure line goes down. Decreased preload means that this point and diastolic volume goes this way, to the negative side. Now let's move on to this page of first aid, guys. I'm going to explain to you the valvular problems, their pressure volume loops in a very I'm sorry, guys. So when blood leaks behind during diastole, that means I have blood from everywhere. Blood coming from the left atrium, blood coming from the aorta. So you got so much blood filling the left ventricle, it's like overwhelmed. So you got so much blood filling, that means so much end diastolic volume, so much preload. And if you go back here, you're going to see that more preload means more stroke volume. And we know that this point is the point of preload. You move it this way, it increases. We have so much preload, so the end diastolic volume increases. And because preload increases, stroke volume increases, so the curve is going to be wider. Moving on to mitral valve problems. Let's start with mitral stenosis. So what's going on? So this is normal diastole when the mitral valve should be open and blood should flow smoothly from the left atrium into the left ventricle. Now, when their mitral valve is stenotic, the left atrium is facing so much resistance in its phase in order to push blood into the left ventricle. So not enough blood fills the left ventricle. Not enough blood fills means we do not have enough end diastolic volume. We do not have enough blood by the end of diastole. We didn't get the chance to fill the heart completely during this time because the door was narrow. Now, because we have less end diastolic volume or less preload, that means you have less stroke volume. So less preload means I'm going to move this point here negatively, and less stroke volume means the curve is going to be, or the loop is going to be narrower. Now, because we did not have enough blood to begin with, so we're not pumping enough, that means less stroke volume, and whatever remains behind is also not enough, so the end systolic volume will also be low. Finally, I'm going to talk about mitral regurgitation. During mitral regurgitation, we are in systole. During systole, the mitral valve should be closed. However, because of regurgitation or insufficiency, there is a leak. So during systole, blood should only be going forwards into the aorta. But because of insufficiency, some of it leaks behind. Now, because some of it leaks behind and then fills the heart again in the next cycle, you will get more end diastolic volume, because it's being kind of accumulating from previous cycles. It's going to fill more. So you got more preload, and more preload means more stroke volume. So you should expect the point of end diastolic volume to move this way, and the curve should be wider because of more stroke volume. At the same time, there is something not everyone notices. There is less resistance. Imagine, guys, if you are pushing this cart, and this is supposed to be blood pushed through the aorta. and you have a closed door behind you, which is the mitral valve. It should happen in normal conditions. Now, when this is so heavy, you don't have a chance really, because there is a wall behind you, you can't get any help. But what if this door is open? You got less resistance. You can go back, take a push, and then go forwards again. Now, because of this is what we call less resistance, there's kind of a space, right? And this is what decreases the end systolic volume due to less resistance. What we mean by less resistance here is that more blood is able to be pumped out, and so less blood remains behind. I hope this makes sense, guys. I tried to be comprehensive. I tried to simplify it. So hopefully by the end of this video, these questions should be a piece of cake. Let me know what you think in the comments.